Hi everyone, welcome to today's episode of Aesthetics and Wellness. Today we've talked all about non-surgical rhinoplasty, who is a good candidate, who might not be a good candidate, what the difference is between non-surgical rhinoplasty and surgical rhinoplasty, and also the risks associated with the procedure, and what we can do to help keep you safe and what you need to know before going to have this procedure from someone you might find on the internet. I hope you enjoy. Welcome to today's episode of Aesthetics and Wellness by Dr Yusra. I have got the lovely Sophie Carson, my right-hand lady, with me today. And today we're talking all things non-surgical rhinoplasty. I believe you have a whole list of questions to ask me.
Oh, yes.
Oh, yes. So non-surgical rhinoplasty is one of our most requested procedures, isn't it? I do quite a lot a day. Quite a few patients come to see us from
all over
the world. For this particular procedure, and it's probably the most popular procedure in both the London and Liverpool clinic. I also teach non-surgical rhinoplasty. I'm a speaker, I'm an educator. I have formulated a masterclass on non-surgical rhinoplasty, and I teach doctors, dentists, nurse prescribers how to perform this particular procedure, which is a complex procedure, but a really life-changing procedure.
Yeah, definitely.
Yeah.
Definitely. We see so many patients come out with tears in their eyes, just completely overwhelmed, I suppose, by the change that they maybe thought they had to go down the surgical route to get, but it's a really relatively quick procedure. It's not got like the downtime or anything like that. So I think first thing first, for patients that maybe don't know, what is a non-surgical rhinoplasty?
So a non-surgical rhinoplasty is a procedure that changes the shape of the nose without the patient having to undergo surgery. And traditionally, what we would do, well, back in the day, before non-surgical rhinoplasty existed, what was the only treatment option for patients who disliked the appearance of their nose was surgery, where they had to undergo a surgery, be under the knife, so to speak, be put to sleep, have considerable risk and downtime associated with the procedure and with the anesthetic, and where they would have a permanent change to the nose. And it's still a procedure that is done worldwide, surgical rhinoplasty, a great procedure for a lot of patients, but a lot of patients can't either afford to have a surgical rhinoplasty or who don't want to have a surgical rhinoplasty because of the cost, because of the psychological impact, because of the downtime, because of the maybe the extent of the change as well. You know, like I think it can be quite scary to undergo a surgery.
A lot of some patients I know I've seen come across have had the non-surgical rhinoplasty before making a decision whether they want to go down the surgical route, because it may give them an idea on what it could look like, a change, but at least they know with the non-surgical it is reversible. You know, if it's not what they want, we can change it back to the original nose.
Yes. So non-surgical rhinoplasty is where we use a gel, a biodegradable implant. It's called hyaluronic acid. And I think it's really important that you actually in the nose only use hyaluronic acid, which is it's a temporary filler. And when I say biodegradable, over time it will break down. So it's not a forever thing. And we inject small, what we call micro droplets of this dermal filler into the nose. And the gel is made out of a sugar molecule, which is naturally occurring. So it's found in your tissues, it's found in your skin, it's found in your bones, it's found all over. And hyaluronic acid is a sugar molecule called a polysaccharide, which retains water. It sucks water into the area. And it comes in different forms, different sizes. You can have large particle size, small particle size. And so when we're talking about reshaping the nose, you want a gel that is firm, that will stay put. It's not going to move or migrate. It's not going to suck too much water in, because you don't want to have a voluminous large nose. No. You want to have definition, precision, shape, rather than, big chunky cheeks maybe.
Yeah. I think that's a concern from patients. So when they inquire, they're worried that it's going to make their nose look bigger, which
Absolutely.
is not, it's not what it's designed to do, is it? It's not what it's there to do.
Yeah, it makes sense that they're afraid of that, because filler is a volumizer, and therefore it's really important that you choose the right filler, because not all fillers are made equal, both in terms of the like I said, the particle size, but also the brands and safety. Some of the fillers in the market, regulation we know is really poor in the market, unfortunately, which means the lovely Calvin here, who's recording our podcast, could buy filler from eBay and inject it into you. There is no regulations to stop a non-medic injecting a implant into you, and it's really quite scary.
Very scary.
But what that also means is often they are accessing cheap or unregulated products that have not been safety tested. And of course, you know that I'm very firm and very clear, and I prioritize safety.
Yeah.
And so we don't have cheap fillers. We have the best fillers, and fillers that have been around for a very long time, that are safe, that have been regulated, that do what they say on the tin, that have significant amounts of safety testing, that have a good manufacturing process, that have a low risk profile. Ultimately, I'm responsible when I'm taking needle to face that I am injecting a safe product that's not going to react with my patients. And of course, there's always risks, but it starts with choosing the right product.
Yeah.
So with this product, when we are injecting the nose, we can hide a hump. We call it masking a hump. So if somebody has a bump on their nose, we can hide that. If somebody has a downward drooping tip, we can lift it. If somebody has a deviation to one side, we can straighten the nose. So there's a lot that we can do with non-surgical rhinoplasty. And I think it's a really good thing to consider. If you're thinking of going down the surgical pathway or the surgical routes, then it's important to know all your options. And a non-surgical rhinoplasty is a really good option for a lot of patients because it affords them a simple procedure that's, minimal discomfort. I wouldn't even call it painful, minimal discomfort. You've had it.
I've had it, and I have to say, no, I'm not one. You know what I'm like? Yeah. I'm not one, but I found that fine, absolutely fine.
Yeah.
It's, for me, when I had the treatment, it was quite small needles, absolutely fine, perfectly comfortable. We do apply some numbing cream, don't we, to make it extra comfortable, but you probably don't even need that.
I forgot that you had it, you're
right.
Yeah,
and I mean, and I love it. Yeah. I love the results.
And it's so natural.
So
you can't
subtle.
tell, right? That's the whole point, is that it really respects the normal anatomy of your face. So sometimes, unfortunately, you see patients who've had surgery and you can tell.
Yeah.
You can immediately tell because it's somehow distorted, even if it's a microfraction, it's somehow distorted the natural architecture of the tissues, and therefore it throws the face off balance. And if you've known that patient or that person, it suddenly looks like a significant change. And I know as soon as the patients walk through the door if they've had surgery, but I'm a trained professional, so I can tell. And the beauty of a non-surgical rhinoplasty is that it's so subtle, yet significant. You can mask major humps. I mean, if people want to see the type of work that I do, you can go on my Instagram handle, Dr Yusra Rhino, and you can see a whole range of different shapes, sizes, colors of noses that we have transformed within minutes. So the patient doesn't have to undergo general anesthetic. They don't have to be put to sleep. They don't have to go under a knife. And you can transform something that has held them back for years and years and years, because unlike other procedures, so, you've had your lips done as well, you've had a little bit of Botox. That was maybe a juge, and yes, you have your Botox for migraines. But the nose is different. The nose, when patients come in, they say to me, they don't just go, I want to do this because I want to look better. They say, I hate my nose. I've been buddies about my nose. I won't take pictures because of my nose. If I'm having dinner or I'm on a date night, I'll always keep my hair down so I can hide my nose. If I'm driving and I'm about to stop at a red light, I won't stop right at the front. I'll hold back so that the person in the car next to me can't see me. If I'm in a meeting, I'll make sure I'm sitting opposite someone, not next to them, so they can't see. So these are the small psychosocial impacts that a burden like a dorsal hump deformity or a nasal deviation can have on patients. And I think it's really important that we don't judge that, but that we accept that and we support our patients' rights to determine if they wish to seek treatment. And if they don't, that's also fine. Like I know so many people who we're all perfectly imperfect.
Yeah.
So there is no need to change something. And what we're changing is not just the aesthetics or the physical appearance, but actually we're taking away the psychological burden. Yeah. So if you've got a bump in your nose and you're caning it, like for example, that singer, Kate Middleton has a little bump on her nose. It looks so good. Meghan Markle has a little bump on her nose. It looks so good. Cheryl Cole has a little bump on her nose. It looks so good. It suits them. Yeah. So sometimes our little imperfections are perfect on our faces.
They what make you.
They give you character, and you look beautiful with it. So unless it impacts you, don't change it. So, sometimes I come in and patients say, oh, I'm having it done because, I don't know, Kim Kardashian had something done. Or I'm having my lips done because Kim Kardashian or Kylie Jenner. I'm like, no. That's not the right reason. And my job is to safeguard my patients and be aware and cognizant of their sphere of influence, that they're not making decision because of peer pressure or because of the latest influencer doing something, but because it will empower them. And that's what it comes down to. It comes down to empowerment.
And it definitely does. You see patients going in maybe who are quite, maybe we'll sit in the waiting room with the head down and won't look up and won't make conversation. They come out and it's like a whole different person. And we've got 3 lovely mirrors in the waiting room, and while we're raising their invoice, you can see them like admiring the nose, taking pictures, and it's just amazing. It's like a new lease of life for them. It really does change people's lives. And before I started, I had no idea what non-surgical rhinoplasty was. I remember my first day and someone asked about non-surgical rhinoplasty and I was like, what is it? But I don't think it's spoken about. I really don't. I think people think, if I don't like my nose, I've got to get a nose job. They maybe don't realise that there is an option there to have.
That's a good point, because I've obviously been doing this for a long time. I've been in the aesthetic industry for over a decade, 11 years. I see about 200 patients a month. I've treated tens of thousands of patients, and when we're in this little box of doing something every single day, day in, day out, you assume other people know. And it's good to hear, actually, there's still a gap in people's knowledge. And sometimes I get surprised because patients come in, they say, oh, I was searching for surgery. And then I found out about this. So I think a lot of people still don't know. And I think that's the value of doing this podcast, is that empower people with information so that they can make an informed decision about what's right for them, because surgery might be right for them, but it's important to know all your options.
And I know that's something you always discuss with a patient. You're not just going to do the nose if it's not the right treatment for them. Surgery might be the better option for them. So I know you let them know, and the patient they make an informed decision, don't they? And patients may go away and think, you know what, actually I'm going to go down the surgery if that's what's right for them, and that's okay. We're not forcing anyone to come in and have anything done. It's the patient's autonomy and
that's
their
not
own decision.
That's like the opposite of who we are, I think, as people, where all of us, I think, it starts from the top down. It's your ethos, it's your culture. I think every single, this, I never start my day going, how much are we making, or how much did we make today? It's just not, it doesn't feature. It's how happy are our patients. That's my why. That's what I want to do, is I want to empower my patients. I want to ensure that they feel good, they look good, they're happy, that we've supported them. It's medical, it's care. It is fully about really what we have on our wall, which is empowering transformations. So, and that's an inside out approach. It's not physical transformations. It's how do we make our patients look good, but also feel good. Hence our tagline, radiance on the outside, wellness on the inside. So I'm not afraid to say no. You know this, I say no every single day. If something isn't right for a patient, I will be very firm in my ethical position of safeguarding them from treatments that they don't need and saying no if they don't need it.
And maybe going a little bit off topic here, but I know often with a non-surgical, it might not just be the nose that needs to be treated. It could be other areas of the face in order to get that balance. And patients may come in thinking it's that, just the nose, and they will leave maybe with a little bit in the chin as well, because it's helped to balance. Or maybe they didn't need the nose. It wasn't the nose they needed. It was a bit in the chin or cheeks or whatever it may be. But you give them that knowledge, so you're not.
This is a really good point. I think when patients come in and they say that to me, I don't like my nose, I want to have a non-surgical rhinoplasty, comes down to me performing an assessment. And often what I find is the nose isn't an issue from an aesthetic point of view, and I have to make that objective analysis. And what happens is, if a patient has an underdeveloped mandible, which is their chin, if their chin is congenitally underdeveloped and it's sitting too far back, remember that the nose is sitting right in the center of the face, and it's also the only feature that sticks out of the face. So when we're assessing the nose, it's relative to the rest of the face. So if the nose is sticking out, or the patient perceives that the nose is sticking out, or feels that it's big for their face, it may be, and often is, because their chin is underdeveloped. And actually, by correcting the position of the mandible, i.e. with using a procedure we call genioplasty, which is chin augmentation, we can bring the chin point forward, we can balance the profile, and the patient may not need a non-surgical rhinoplasty or any procedure on their nose. And I've written an article about this. It's called Profiloplasty. You can Google it and get it it's on the Aesthetics Journal. And what I've said on there is that the astute clinician will perform a full face holistic assessment, because patients are always aware of their sticky outy features. They're aware of their prognathic features. They're not aware of their underdeveloped features. And it comes down to us to be ethical in our approach and advise our patients on what will be of benefit to them and what may not be of benefit to them. And if a non-surgical rhinoplasty is not indicated, you don't just do it because it's going to, you don't think about lining your pockets. You think about what's best for the patient. And being clear is very important.
Yeah, definitely. Is the procedure safe? I know lots of patients come in and they can be quite worried about having the nose because it's the nose and they're worried. Is it a safe procedure? And like we have ultrasound in the clinic.
Yeah.
How do they work? Is it safe? What can we use to make it even safer?
Great question. A non-surgical rhinoplasty is a safe procedure in my viewpoint. Having said that, it carries significant risk, and it is the highest risk procedure to inject in the face. And the reason why is because the blood vessels that sit in the underlying tissues of the nose connect directly with the eye. And therefore, if a filler sits next to a blood vessel and irritates the blood vessel, that blood vessel can go into spasm, and all of the blood vessels that it feeds can spasm and close up. Or if filler is inadvertently injected into a blood vessel, then it can travel up and block the eye. And that can result in permanent visual loss. Now, there are over 200 cases of permanent visual loss globally. Thankfully, it's never happened in our clinic before. And I don't want to jinx myself, but by the grace of God go I, and I really hope that never ever happens. But I'm always cognizant and aware of that potential risk, and we discuss it with our patients. And it's important that they understand that so that they can make an informed decision. Everything has a risk, whether you go through surgery or non-surgical, whether you get on a plane or a train or a car or haven't taken a needle to face. But certainly the nose is complex, is very high risk. And if there is a visual loss, it can be permanent, and most of the cases are permanent. Now, out of the 200 reported cases of permanent visual loss worldwide, 33% of them came from the nose. So not all. And you can actually go blind from chin filler. You can go blind from lip filler. You can go blind from cheek filler. So all of these procedures, there are documented, reported cases of permanent visual loss. So it's not something to take lightly. And that's why it's really important you see a medical professional who is very well trained in the anatomy of the face. And, you've only got one face. I always say, even if I've got 10 toes, but I wouldn't let a plumber inject my toe. I wouldn't. You'd be surprised that there are these people injecting the face, right?
We've heard the horror stories,
unfortunately, not far in Liverpool, there are people doing surgery. You know this. One of our patients told us. In their bed, in their living room, on their sofa, putting implants in people's noses. So this is an unregulated market. That means people on social media can claim to be something that they're not. It's very important that you do your research and check, does that person that's about to take needle to face have the appropriate training, the right ethos? Are they regulated? Are they insured? Are they medical professional? Can they safeguard you if a complication does arise? Because complications happen in doctors' hands. There is no doctor on planet Earth that will tell you that they've not seen a complication. They say that to you, they're either lying or not done enough. Complications happen, but it's about how you manage them. Do you safeguard? Do you handhold that patient? Do you look after them? Do you do everything in your power to help them? Do you liaise with other medical professionals, or do you block them on Instagram? And unfortunately, the patients that I end up seeing in my complication clinic are patients who have been referred or who find me after they've been blocked by their social media injecting clinic, who they thought were doctors and who were not. And because, fillers are not regulated, but actually the antidote to filler, called hyaluronidase, is an enzyme that is a prescription-only drug. You can only get hold of that prescription-only drug and only inject it if you are a medical professional or prescriber. So what that means is the plumber or the beautician who's best placed doing beauty work and not medical work can't reverse a complication. It is not within their scope of practice. It is not within their remit. They do not have the license to procure that medication, and therefore they can't help that patient. So suddenly they block that patient or run a mile, and that patient is lost in the wilds, in the wilderness of the wild west, trying to seek help. So go to someone who can look after you, not just when the times are good, but also when the times are tough.
And not just because someone's put medically trained on their bio on Instagram, for example. Make sure you're researching that they are a medical professional that can help you if the worst was to happen. And then you asked me about what we can do to safeguard our patients and reduce the risk. Because like I said, complications can happen in anyone's hands. There's a number of techniques, skills, tips, methodology of approach, one of which is using a microneedle. I use a BD insulin syringe, which means I'm really controlled in the droplets that I place. I call it micro droplet technique. I'm injecting on the deepest plane. So again, it's a real manual dexterity, it's a real control
of product placement. It's where you're placing pressure to stop the blood flow. So when I'm injecting the nose, I'm always putting pressure on the blood vessels on the side of the nose. People probably don't understand why I'm pinching their nose. I'm pinching it to stop the blood flow because I know that reduces the risk of a complication. So there's a reason, there's method behind the madness. They're also utilizing tools like ultrasound technology. Ultrasound technology has been around for a really long time. It's a technology that assesses what lies beneath the skin, and we can now see the vasculature that lies beneath the skin and therefore map where those blood vessels lie and avoid them when we are performing a non-surgical rhinoplasty, for example. And that is a tool that has certainly elevated safety in the aesthetic field. And I would advocate for any patient who is having a complex procedure, a high-risk procedure like a non-surgical rhinoplasty, to consider having it done after appropriate ultrasound mapping by a professional who's trained in ultrasound, so that again it's another added layer of safety. Kind of like if you were getting in a car or going on a plane, you would want to make sure that your driver was appropriate or your pilot was well trained, well experienced, qualified, wasn't just taking this flight and had no idea how to land, how to also avoid, how to navigate a storm, because those things can happen, how to land safely, how to prevent a crash. And also, you wear your seatbelt, don't you? Because you want to mitigate risk or you want to reduce the risk and add an added layer of safety. And that's what ultrasound does. It's an added layer of safety. We can't say that it will reduce all risk, but it would certainly add another layer of safety and provide a roadmap for where is safer to inject and where is a no-go area. Yeah,
and it's really fascinating. I know you've done ultrasounds on me before, and I've been fascinated by, what you can see and what we have in our toolkit to be able to protect patients ultimately to the best of our ability.
Yes.
And I suppose leading on from this, we do have patients come to us who've had a surgical rhinoplasty, who it's not been maybe what they wanted. It may have gone wrong. Can we treat patients who've had surgery before?
Absolutely. About 30% of my patients are patients who've had surgery in the past. Surgery predisposes to higher risk because what it means is somebody has gone in underneath there, and that will result in scar tissue. Whenever you have surgery, you will have scarring, which means that the second time we go in to perform a procedure, that we're navigating scar tissue, not normal tissue. And scar tissue is tough. It's tightly adherent. The skin is tightly adherent to the underlying structure, i.e. the bone or the cartilage. And the blood vessels are not mobile. They don't easily move. And that can be problematic because if they are tightly adhered down to the bone or the deepest structure, which is usually the layer in which we are injecting, there is a higher risk of having an adverse incident or a complication. So in those patients who have had surgery, I always perform an ultrasound. I will not proceed without performing an ultrasound. And I would say do not have a non-surgical rhinoplasty procedure if you've had a surgical rhinoplasty in the past, either suboptimal results or gone wrong or whatever it may be, you're unhappy with the result and you want to tweak it or improve on it. We absolutely can help you, but it has to be under ultrasound. And so my technique will differ. I will also use a micro cannula, which is a round tipped probe instead of a needle, which will not perforate a blood vessel or less likely to perforate a blood vessel. So it's an added layer of safety. And the more surgeries you've had, the higher the risk is. But yes, we treat patients all the time. And the ultrasound also allows me to say which patients I will treat and which patients I might say, listen, it's best you don't have this procedure. It's too high risk in it. It's better to keep your nose as is than to lose your vision. And I'm very honest with my patients. I think, treat your patients how you wish to be treated, how you want your mom to be treated or your sister, or your best friend. So if I think a procedure, actually in the risk benefits analysis, if the risk is too high and the benefit is too low, then it's a no. If I can make a considerable benefit and the risk is controlled, then we can help them. And we, as you know, I see patients from all over the world who come from New Zealand, from America, very routinely fly in from America for procedures like a non-surgical rhinoplasty, particularly after suffering an unfavorable results from a potential surgery. And I'm not bashing surgery. Surgery is amazing. It's great for a lot of patients. But like all procedures, sometimes the outcome isn't what the patient wanted.
Yeah. So how long after a surgical rhinoplasty could you come for a non-surgical rhinoplasty?
12 months. I would say not before that, because the nose continues to contract. The swelling takes time to settle. And in surgery, it can take up to 12 months for the tissues to fully settle. and putting filler in before that predisposes to increased risk. And you don't have a settled endpoint, so it doesn't make sense. I think another really interesting thing is patients who've had surgery, sometimes when they come to see us, they'll message us and say, can I come because I'm not happy with my nose? And they might be 6 months post-op. And I say, no, wait until 12 months. And sometimes I see patients who've had their nose after surgery for 20 years.
Yes.
And they've either been unhappy for a really long time or their nose has changed over time.
Okay.
Because remember, the nose is the skeletal base, or the structural support comes from cartilage and bone.
Okay.
And as we're aging, the hole on which the nose sits on the bone is called the piriform aperture. If you look at a skeleton, there's always like this black round bit on the skeleton, isn't it? That's called the piriform aperture. It gets larger as we age. Okay. And because it gets larger as we age, as the bone starts to shrink back, the nose starts to drop. But also, after having surgery, the contraction of the scar continues to contract every single year on year, for many, many years. And that's called scar maturation. So the scar continues to mature and change and develop and settle and tighten for years to come. So a nose that might have looked good immediately post-operatively might in 10 years' time look quite deviated or very different because of that scar contraction over time. So I see both ends. I see patients who've had a nose done after surgery, haven't been happy, and come 10 years later. And I've seen patients who come within the first year.
Okay. Permanent fillers.
Yeah.
What's your opinion? I know it's not something we offer at the clinic.
Yeah, it's a no from me.
Yeah.
It's a hard no. I think permanent fillers are exceptionally risky. And I think the beauty of what we do as a non-surgical field is that it is non-permanent. If patients wish to have a permanent result, they should go off to have surgery.
Yeah.
Now, having said that, what we do know is that even with a non-surgical procedure, using a biodegradable implant like hyaluronic acid gels, which we routinely use, fillers last a lot longer than we once thought. And you'll know, you last had your lips many, many years ago and there's still filler in there. Filler lasts for years and years and years. That's great. That means you don't have to keep having a procedure done again and again and again, year on year on year. And particularly with the nose, because the area is non-mobile, doesn't move.
Yeah.
It's firm, it's set. The filler lasts for several years. So I often see patients, at the beginning I say the first time you have a non-surgical rhinoplasty, you may wish to have a top-up or a retreatment a year later.
Yeah.
And then after you've had the first two, you probably find that it lasts years, 2, 3, 4 years. I have patients who fly in from Belgium every 4 years and it still looks really good. And I'm like, oh, well, since you've flown here, maybe we can make it a little tweakment. But there isn't really the results. It's the gift that keeps on giving. The results last a really long time. So on that note, with regards to permanent fillers, you can't dissolve them.
Okay.
And if, God forbid, they go into a blood vessel and they cause a complication like a vascular occlusion, which means it stops the blood supply to the skin, if that happened with a hyaluronic acid filler, you could just take out the antidote, which we use to dissolve the filler, and we can dissolve it and restore normal blood flow. If it's a permanent filler, we cannot dissolve it, and if it stays there, essentially what will happen is permanent damage to the skin, and that is obviously unfavorable. So why would you put your patient at that risk? It makes no sense to me. The complication rate is much too high. It's a hard no, particularly in a complex area. I think anywhere in the face, permanent fillers I'm not a fan of, and also anywhere in the body really. I mean, I've heard of people using permanent filler in the bum. It's a no. Eventually your body may reject that filler. You might get a granuloma. And I think you're putting your face at risk, and just don't do that. There's no need to. The fillers that we use are so premium, so good quality, so long lasting that there's absolutely no need to put yourself at that risk. So no.
Great. So no permanent fillers.
No permanent fillers. No permanent fillers. I think this procedure is probably one of the most life-changing procedures. It's incredible. I always say there's magic in our 4 walls. When we treat our patients, we don't just see the aesthetic transformations. We see the empowerment that they have. And when they come back to see me years later and I say to them, so how are you? And how is it? They don't just say to me, oh, my nose is great. They go, you know what? I don't think about it anymore. I went for that front-facing job. I went on that first day. I'm now on TV. They're no longer held back by it. And what I feel that I've seen over the decade that I've been doing this, or last 14 years, is it's that psychological impact, that social impact, that empowerment that patients get that is so truly magical and so fulfilling to be a part of. It's not just making them look better, but it's making them feel better and putting their best self forward and really just showing up in their life fully without feeling held back. And I think every single person has a right to feel confident in their daily life, in their daily interactions, and should be able to express themselves and smile fully and freely without feeling held back. So for me, why I love that procedure, why I love doing it, is because of those transformations that we see. The artistry is one part of it, but the empowerment that I see patients get, that confidence boost, that's magic.
And that's the clinic why, isn't it? That's what we're there to do. We're there to empower patients, and it's so lovely to be a part of their journey. Well, thank you for answering all my questions.
Thank you for coming on.
Thanks for having me.
Thank you. I hope you guys enjoyed.